Sometimes I have my normal, and then sometimes I'll have a light one, and then sometimes I'll have a heavy one.
Yeah.
Does that mean I was going to have 2 babies?
No.
No? Oh.
Yeah.
Always in my mind, I was like, I could have had 2 babies this month. Because it made sense to me that my lining would get thicker.
Sure.
Ashley Danner had a pool party when I was in the 6th grade. She was pretty popular, and my friend Heidi and I were super excited to go. The only problem was I was on my period, and so was Heidi. And up until that time, neither one of us had ever dared try a tampon. It was super scary. The idea of it, really kind of taboo. This was a part of our body we were just learning about, and it had to do with sex. I remember wondering if I was going to still be considered a virgin if I used a tampon. Can you imagine? Anyway, we had 3 days to figure this out. Every day after school, we went to Heidi's house and tried our Tampax best. There were tears, there were hand mirrors, and finally, on Saturday morning, boom, we did it. We were ready for the pool party. I still have the journal where I wrote my journal entry because I was so proud of that moment because it had been, honestly, a bit of a saga getting there. But we made it to the pool party. We learn all about our bodies and periods and how they work physiologically in sex ed class when we were in middle school. But when it finally happens to us, there are so many things we are clueless about, like tampons. And newsflash to anybody pre-baby or pre-40 listening, things change all throughout your menstruating years. And let me tell you, my name is Sarah, and I have some questions. All right, so I've got Anna Fleischman with me today. She is an OBGYN with WakeMed. And we're talking periods today.
We sure are.
One thing that is very interesting to me is when you try to talk to your mom about it, you're roughly the same age as me. You're like, you're a millennial?
I'm a millennial.
Yeah, I'm a Xennial.
Yep.
So I'm in that little midterm.
My brother's in that term too.
Yeah.
We always will compare both. So.
Yeah, it's funny. Yeah. So, but when we talk to our parents who were boomers, they are really, I don't know. It's a whispered conversation.
Hush, for sure.
So there are some changing social attitudes here. Have you found that to be true in your practice? Because I'm sure you have older people versus younger people in your practice.
Yeah, definitely. I see a spectrum of ages, and so I think social media has played a huge role in getting people to talk about it more, talking about what's normal, what's not normal, what you should talk to your OBGYN about. So a lot of my one of my offices is on the NC State campus, so I see a lot of college students. So they bring in a lot of fresh questions. And
I can only imagine.
They love talking about it. So.
Oh, good. Well, that's true. I really think, especially the women of the younger generation, the Gen Zs, they don't care.
Yeah.
And I love Gen Z. I love them. All right. So let's just go back to the basics. I haven't been to sex ed in a while. Okay.
Sure.
What are the mechanics of a period?
So first is kind of the frequency. So kind of what's the day or the timing between first day of one period to the first day of the next period.
Okay.
So that's the frequency. So when people say, what's your cycle length? That's kind of the mechanism of what we're asking. So that's usually around 25 to 35 days. Everyone's a little bit different.
Okay.
The next is the duration. So like how long is the bleeding lasting? Mm-hmm. And that can vary too. So the minimum definition or the lower amount of days isn't really defined very well, but some people kind of 2 to 3, lucky.
Yeah, I was just like, man, that's never been my
life.
Yeah,
kind of, all the way up to like 8, maybe 10, but 10's getting long, so usually 8 is kind of our cutoff.
Okay.
The change within it, so if you're typically a 25-day cycle, you always a 25-day cycle. No one usually is like spot on. They can be like
that's good to know.
Yeah, they can be a day or two off.
Okay.
But really, when you're in that kind of 25 to 40-year-old, you're going to have more of maybe 7-day difference, even though that seems kind of a lot.
Okay.
But that's what the research shows.
And you're saying in frequency and not in duration.
Right.
Okay.
Right. Sorry.
No, it's all right.
Yeah.
Yeah, because I know that, as I've gotten older, my period can last 12 days.
Yeah, and there are definitely changes. I kind of use that 25 to, or even like 18 to 40, because that's when it's the most predictable.
Yeah.
When you're younger, you have a lot more changes to it. Your body's getting used to it. It's trying to figure out the cycle of hormones. And then when you're older, you're getting into changes of hormones again when you're getting in that perimenopausal transition.
I see.
So it definitely can change.
Yeah, I think that's where I am.
Yeah.
We're going to talk about menopause next week.
Nice. Perfect.
Which is exciting because there's tons of questions there too. So I want to talk about cramps really quickly because, you definitely associate periods and cramps together. What exactly is causing a cramp?
Yeah. So it can be a few things. When we first think of when you're first having your period, we say the normal primary reason is that the lining of the uterus that's thickening with your cycle. So that's the estrogen effect. It's building up that lining. It actually, when the sloughing happens, it releases these factors. They're called prostaglandins.
Ooh, prostaglandins.
Yeah, fancy word.
Kind of sounds like an action hero.
and that actually causes the cramping. So it's a similar kind of mechanism actually for labor where prostaglandins are released, softening the cervix.
What is it, like a hormone?
It's more of an enzyme. Yeah.
An enzyme. So it's like literally kind of, eating away at the wall of the uterus?
It's just kind of, it's signaling. It's a signal to the uterus to cramp and squeeze to help shed the lining.
An
so more
enzyme
of like a
does that.
signal. Yeah.
Oh, interesting. I didn't realize an enzyme could do that.
Yeah.
Is there any changes to cramps that happen over time? Because I remember, anecdotally, I remember when I was younger, I'd have to miss school.
Yeah.
I even ended up having to go on birth control back in the day because my cramps were so bad.
Yeah.
And now that I'm in my 40s, they don't really bother me anymore. I don't hardly have any.
Yeah. People can notice changes. I feel when you're first getting your periods, when they're trying to become regular and figure themselves out, a lot of younger women or younger teenagers will experience more significant cramping.
It's awful.
Yeah. But some others won't have much in the beginning. And then if they are childbearing or they have children, a lot of times people will notice changes in their periods after that. So either getting worse or better.
Yeah, I've actually heard that they switch. Like you have one kid and then you have cramps, then you have another kid and then they go away. And is that something you see?
Yeah, it definitely can. Or like the heaviness of your period can change too. So some people have heavier periods or lighter periods after delivery.
Interesting. What are some disruptions with your period or missed periods that can happen that aren't associated with pregnancy?
Sure. So when you're younger, your body's trying to figure out the cycle of hormones. So we kind of think when someone is a teenager coming in to see me or when they first start having their period, it's not unusual for them to be irregular or to skip periods. So that's kind of one category. That's mostly that your communication between your brain and your ovaries is trying to figure itself out.
Oh, interesting. Like build the pathways.
Yeah. And we call it the HPO axis or the hypothalamic pituitary ovarian axis.
Ooh,
yeah,
that's
fancy.
a long business card.
But that's the communication that use it to signal your ovaries to produce estrogen and progesterone. And those are the two main hormones with your cycle. So when you're younger, it's a little bit irregular. It's not quite figuring out how to talk to each other. We call it immature at that point.
That makes sense.
And a lot of times people, by 1 year of after having your period, will start to, 65% of the adolescents will start having normal monthly periods. That's only 60%, right? So it can take a couple more years to regulate.
Okay.
First things I start to ask are there any changes in your environment, whether you have more stress in your life or maybe gained weight or lost weight or been exercising more. Yeah, so it really is it can affect the estrogen concentration and kind of the release of estrogen from your ovaries. So it just, and sometimes stress in general changes cortisol, and cortisol can play a role in it. So it's all these different hormones that can play a role.
So I know that when you lose weight, I've heard that often, that if you lose weight too quickly or just too much,
right,
you won't have a period. But I've never heard it said when you gain weight.
Yeah, so adipose tissue, which is another fancy way of saying just the fat tissue or external, we make estrogen both in our ovaries but also in our fat cells. So individuals who do hold a little bit extra weight make a little bit more estrogen. And so that's then communicating to your brain that I have a little bit more estrogen, and it's making that signaling a little disrupted.
Oh, interesting. So when I gain weight, I really am more woman then.
Sure.
So Can there be any damage done to this highway you mentioned, the extremely long named highway, the HPOV?
Yeah, HPO axis.
XPO I was close. So can something get damaged along that highway?
We think a lot about, I mean, if there's anything that's going to cause like your ovaries to decrease hormone levels or your brain to not have that signaling pathway. So first thing to think about kind of masses. So any type of ovarian cancer or tumors that may produce too much estrogen or too little estrogen. Chemotherapy can definitely hit the ovaries. It hits quickly dividing cells, and your ovaries are doing that every month.
That makes sense.
Yeah. Radiation can do it too.
Yeah. I've
or
never
pituitary
had it
masses.
That way. Yeah. Pituitary masses. So if you're missing, when do you know it's a signal to call a doctor? Because like you said, you sometimes, especially in the early days and in the late days, those are you're going to have a regular period then. But like when you're in your most fertile years, when is it a time to call the doctor?
I mean, I think it's always a good idea when you're typically very predictable and then you're missing. Sometimes if you miss 1 month, then can you figure out a little bit of what's happening?
Like stress, weight gain,
if you can rule those things out, then it's probably a good idea to still be seen.
Okay.
Because there are things that we can do to test for it or to look what's going on.
Can sleep affect your periods?
Sure. Yeah. I mean, that can go along with the stress pathway. Yeah. So increasing kind of cortisol with that.
All right. So I read this and it fascinated me. And I'm sure by now you've heard about this. It's called a woman being a year in terms of her period. So what I've heard is your period is winter.
Okay.
And have you heard this?
No.
Oh, really?
You'll be teaching me something.
Okay. Well, I was going to ask your opinion on this. Your period is the winter, and you don't want to do too much. You're just kind of lying around.
Sure.
The week after is considered spring. That's leading up to ovulation, so you have lots of energy.
Yeah.
Ovulation is called summer.
Exciting time.
Yeah, you're right.
More
sexy.
frisky.
Yeah, exactly. You feel beautiful. You have more confidence.
Sure.
And then the week right before your period is fall, and you're slower and you need more sleep. Does this all make sense to you?
Yeah, that's a pretty good analogy,
Does
actually.
it correspond to anything medical?
Yeah, so it's really about, again, going back to hormones.
Okay.
So the estrogen and progesterone levels are increasing and decreasing throughout your cycle. So they both start off low when you're having your period or with those bleeding days, those winter days. But you're coming off a high from them. From if you didn't get pregnant, those hormones are going down.
Okay.
And so that can lead to more of the cramping, the sluggish, fatigue,
the
symptoms.
Feeling like doing much.
Yeah, it can lead to nausea. It can lead to breast tenderness, bloating. Kind of all those symptoms that you get right before your cycle, or some people get right before their cycle.
Okay, and why our breasts are tender? Because we know it's hormonally driven, right?
Yeah, right. It is,
but we don't know why.
Yeah, well, a lot of times the hormones there's both estrogen and progesterone receptors in our breast tissue.
Okay,
and so they're getting activated and kind of getting and that can lead to a little bit more enlargement or growth of the breast tissue. Some people see that their breasts change throughout their cycle. Not just in pain or discomfort, but in size.
Oh yeah, I have a period bra.
Yeah,
I have a bra that I can only wear because they get a whole bigger size.
Yeah, and sometimes one gets bigger than the other. Like they can be uneven.
Yeah.
Yeah.
Oh, okay. Anyway, I'm sorry I interrupted
okay.
you.
No, that's okay. But then in the middle, the summer phase.
Yeah.
Your estrogen is going up, and that triggers ovulation. So it's the body's natural way of saying, "Hey, I'm ovulating. We could get pregnant. So let's." Get excited about that.
Yeah. And like you're glowing and you feel fab and your hair looks good.
Right. Yeah.
And then right before it, and this is what it's also I've always wondered, why am I so darn hungry in the fall period, which is the week before your period? Why am I so hungry? Like I legitimately crave meat. Like there's a vision of a cheeseburger that comes up in my brain. And I'm like, I need to eat some red meat. But I'm also like, I will eat a normal amount of food and still be really unsatisfied.
Hungry.
Yeah. What is that?
Yeah. I mean, it's kind of preparing your body. You're having this signaling that is really needing a lot of energy. And a lot of times too, your body will crave what you need. So possibly in preparation for having more bleeding, women tend to be a little bit more anemic than men, even if it's in normal values. But the red meat or the things that are higher in iron, sometimes your body craves those.
Yeah. My husband always looks forward to that week. And I'm always like, I'm craving a burger. He's like, it's steaks
Let's
tonight, baby. Do you think that we should change our exercise routines to match up to these types of feelings in our cycle?
I mean, I think there's definitely people who don't feel comfortable exercising kind of leading up to their period. They don't feel good. They feel tired.
Yeah.
Doesn't mean you can't or shouldn't, but you might notice a change in your energy. So I always kind of tell people, give yourself grace. If you don't feel like doing it, it's okay.
Yeah.
You know?
I mean, that's the hard part with the exercise thing because there's always the guilt associated with it, but there's also something to listening to your body. All right. We're going to get on to more detailed conversation here about periods themselves. Okay? So the bleeding, blood clots. Are they normal and should you worry about them? When should you worry about them?
Yeah. So when we think about how much is too much bleeding, and then we'll kind of get into them like clot forming and things like that, really it's a subjective feeling, meaning that the individual person can tell me, is this heavy for me or light for me?
Right.
You know,
because it varies from person to person.
Right, right. If you're looking at research based, it's about 80 ounces, which is 2.5 shots or 2, ounce. Like
it's honestly more than I expected.
Sure. Yeah. And that's for the whole time. Right?
Okay.
No one's going to measure, right?
I'm not.
But when you're thinking about, is it too much bleeding or are there clotting involved? So too much bleeding is it interrupting your physical life? Is it interrupting your emotional life? Is it interrupting your work day or school day? Can you not go to school? Can you not go to work? Are you soaking through your pants? Is it embarrassing? Right. And so then when you think about clots, what that really is your body, you're having heavier bleeding. So in kind of in that regard could be abnormal. There could be a reason for that. And then it sits in the vagina and actually uses your body's clotting factors. Just like if you get a cut on your skin, your body eventually stops bleeding, kind of coagulates. It brings that blood together. That's what's happening inside the vagina. So it's coming out of the uterus and kind of sitting there.
Yeah.
And then forming a clot and coming out.
Oh, interesting.
So some could be normal, just depending on kind of your body's natural way of kind of getting rid of that blood. But if it's bigger clots, I'm thinking kind of golf ball, lemon size ball, like that's huge, right?
Yeah.
And can be quite startling. So there's definitely reasons more so for heavier bleeding.
Oh, interesting. So I just admit so much ignorance on this podcast. I always assumed that the blood coming out was your lining, like a longer section of it or something.
Right. Well, we always talk about it that way,
Yeah.
right? We talk about the uterine lining or the uterine lining shedding or coming out. So there is tissue that comes out with it, but it's not necessarily kind of together in a line, or in a piece. Some people might notice
it's not like
that.
a shirt your uterus puts on.
Right. But there are so many blood vessels that are coming into the uterus to feed the muscle of the uterus. And so when that lining is shedding, those blood vessels are exposed. They're open. And so until that uterus can kind of squeeze and close off those blood vessels, you're going to have some more bleeding.
Interesting. Okay. I termed this funny because when it was happening to me, I termed it ovulation goo.
Yeah. I know what you mean.
Yes, yeah. I mean, it's a thing.
Yeah.
I'm like, why all of a sudden, I mean, as Amy Schumer said, does it look like I sneezed in my underwear?
Sure.
Like, what's going on?
Yeah. And we keep going back to the hormones. So the reason your body during that ovulation time, your discharge changes. So it kind of comes from like an opaque white color, maybe an off-white creamish color.
Yeah.
It's kind of sticky, right?
Yeah.
It's not gooey. It's not stretchy.
Right.
And then when you get into that ovulation window, the estrogen level, which is higher, is making a change in your discharge so that it is stringier, it's gooier. It allows for the sperm to swim better and it doesn't die off. So it's helping with fertilization. So sperm in that discharge can survive 5 to 7 days. So that's why we have a window. 5 to
7 days.
Yeah. And that's why we have a window for ovulation, not just kind of one day you can get pregnant, because sperm can survive within that discharge.
So how long is the egg sitting in your fallopian tubes and uterus?
So when it's released, if it doesn't get fertilized, that egg can only survive for about 12 to 24 hours.
Oh, really?
And that's all within the fallopian tube. So then it dies off and your body...
So it'll die by the time it gets to your uterus?
If it doesn't get fertilized.
Wow.
Right, yeah.
And so you have this 5 to 7 day window that you can get randy in, and then if you happen to have sex, the sperm can be hanging out, chilling in this ovulation goo.
It's waiting in the uterus and the fallopian tubes, waiting for that egg to be released.
That is fascinating.
And then it travels. Usually, if it is fertilized, it gets to the uterus about day 6 after ovulation. So it kind of takes about 5 to 6, maybe 7 days to travel the length of the tube.
I do have a question about discharge in general.
Yeah.
I don't know if you've noticed this. I think you probably have because most women have noticed
Sure.
this. But like, there's a bleaching in the in your underwear,
Mm-hmm.
and so does the ovulation goo like burn a hole in your underwear? Like, what's going on?
It does have a few other kind of enzymes and things like that. Again, that fancy word, but it can do that. Some people do notice that, and I think it can be contributing a little bit more towards that higher estrogen level. So yeah, you can notice that. Definitely.
Toxic shock syndrome.
Sure.
I remember as an 11-year-old girl being terrified of toxic shock syndrome. It's just like quicksand.
Right.
I thought quicksand, due to the cartoons in the 80s, I was going to be a much bigger problem for me than it actually is.
Yeah.
So I haven't heard much about it since then, though I do see the warning still
right
in
on the box.
Yeah, so what's going on with that?
So that just depends on how long a tampon's left in place. It's probably not as common as we were taught to be scared about it.
Sure.
I remember that in my sex ed class in middle school, to be really cautious with how long you keep a tampon in.
Yeah.
But it is more rare, but it's very serious. You can get very sick quickly. Your whole body can get sick. We call it sepsis.
Oh, I've heard of sepsis. Yeah.
Yeah. But people come to the emergency room because of retained IUDs. They either forget they're in there, or they start noticing a smell or something that, and they just forget that they're there. So they can be there for a few days even without getting toxic shock syndrome.
What are the symptoms of it?
Fatigue, malaise, or just overall tired, body aches, definitely fevers. The bacteria that's there releases a toxin that then gets into the blood and causes all of these inflammatory responses of your body.
Oh, that sounds horrible.
Yeah.
All right. There are other symptoms that come along with your period that I'm just going to kind of tick through.
Sure.
Okay. Headaches.
Mm-hmm.
Why do we get headaches?
Yeah. A lot of times it can, again, it's this cycle of hormones. Sometimes it can be the withdrawal of hormones. So your estrogen, progesterone go up and then they go back down. And that withdrawal of the hormone can definitely cause more of a headache. We call them hormonal headaches.
Are they just like, taking your arteries, your veins, I guess, and arteries, and dilating them, and not, like what?
It could be related to more of that kind of increase in vascular resistance.
That's what I'm looking for. Vascular things.
Yeah,
okay.
Yeah.
My teeth hurt right before my period sometimes.
Yeah.
I did ask my dentist this, and she did say that it can be a sign of this. Do you have anything to add?
No one has ever mentioned that to me.
She told me it was a thing. Like my gums get real sensitive, and sometimes my skin will get very sensitive. Have you heard of that either?
No.
Hey, maybe I'm just a weirdo.
No. I mean, there are so many more symptoms than I'm sure people even talk about, right?
Okay.
Or I had someone in that kind of perimenopausal transition who noticed significantly dry eyes. And so we talked about kind of what that could mean, and she talked to her ophthalmologist about it, and they mentioned too that it could be a symptom of those changes of hormones.
Wow, hormones, they just do everything.
Yeah.
Why does my stomach get so upset right before and during my period? I mean, super upset.
Yeah. So the motility through the GI system slows down. And so you can that's again why you get a little bit more bloating. You just get more retention of that water and food too. So some people get more nauseous. Their stomach doesn't empty as quickly. They might notice a little bit of like acid reflux is a little bit more common.
Yes.
So the muscle that's there that separates the stomach and the esophagus, the tube that our food goes down, is more relaxed. So acid can get back up from that. And so it's just a slowing down of that movement through the GI system.
But I've also heard that it can cause the opposite.
Like cause
diarrhea.
Yes. And some people can notice that too. Yeah.
Okay. So we're going to start with my listener questions. First off, my periods are regular, but they vary in intensity. Some are heavy, some are light. Is this because one of my ovaries works better than the other one? And does a super heavy period mean I'm going to have twins? I was going to have twins.
Sure. Yeah, no, your ovaries kind of work similarly. And there's never really one that's like a champion ovary. But it is random which one you ovulate from.
Oh, it's not. You don't switch back and forth?
You don't switch back and forth.
I didn't know that.
Yeah.
Okay.
So it is random. The fallopian tubes aren't necessarily, I know this doesn't answer the question, but don't necessarily go to like I'm paired with this one and I'm paired with this one. They actually can swing back and forth.
Okay, I was actually going to mention that to you. I call it the space station because in my mind, when I heard this the first time, I imagined the space station arm kind of like slowly moving over to the other ovary. That's incredible. So there's enough room in your body for the fallopian tube to reach across.
Right. And I feel when I was first in medical school or even before that thinking, well, it's just stuck. Like they're attached.
Yeah.
Right?
Yeah. Well, that's the picture you see.
Right. Always. And that's something that I talk about with patients too. So like if they lose a fallopian tube for some reason, a surgery or, if they had an ectopic pregnancy or something like that.
Which is a baby being attaching to a fallopian tube.
Right, correct. Yeah. Then we might need to take out the fallopian tube because it's already damaged from that pregnancy. But if they lose one, the other one can still pick up from both sides. So their fertility doesn't necessarily change.
Fascinating.
Yeah. But to answer this question, so it's not necessarily like one is better than the other. Sometimes you just have a change in that subjective view of kind of what your bleeding is like.
Okay.
But sometimes there are reasons for heavier bleeding. They could be structural reasons within the uterus. So I think that if it's drastically different, something that they should potentially talk to their GYN about.
Okay. Well, then the other question, I didn't mean to ask you two questions at once.
That's okay.
Sometimes I get excited. Does a super heavy period, because sometimes I have my normal. And then sometimes I'll have a light one. And then sometimes I'll have a heavy one.
Yeah.
Does that mean I was going to have two babies?
No.
No? Oh.
Yeah.
Always in my mind, I was like, I could have had two babies this month. Because it made sense to me that my lining would get thicker.
Sure.
Okay. What are the best practices to be hygienic during my period?
Yeah. I mean, I think that you first have to say, are you comfortable? Like, what are you comfortable using? So there are a lot of different options, or a lot meaning kind of 3 different options.
Okay.
In terms of pads, tampons, and menstrual cups.
Okay.
Oh, and fourth, period underwear. So,
yes.
I think it's important to make sure that you're, being hygienic and showering and cleaning.
Well, and on that note, is regular soap going to cut it, or should we be using a fancy soap?
No, I mean, I think regular soap is perfectly fine. Even water can be fine, just plain water. Because a lot of times some soaps can be very irritating to the sensitive tissue of the vulva. So that's why some people get more yeast infections or bacterial infections or things like that, is because they're using more fragrant soaps or more. So I always say, or I think a lot of OB-GYNs will talk about kind of the more sensitive soaps. So there's a lot of different brands that label as sensitive or fragrance free.
Yeah, that makes sense.
But if individuals are having problems with soap use, they're noticing these kind of itching or change in discharge or smell, to even switch to just water.
Okay.
And you never need to douche or rinse inside. Your body's naturally doing that.
Okay.
If you do that, it disrupts the normal balance of the vagina.
Okay.
And can lead to more of those infections.
You mentioned pads and tampons and period underwear and all this. Chemically speaking, why are there chemicals in tampons? I've heard bad things about this period underwear, that there's a lot of chemicals that can be damaging.
Sure.
Do you know anything about this?
I mean, I think that they, I don't know all the specifics. I couldn't rattle off the chemicals that are in there, but a lot of times, they're coming out with more like cotton tampons or.
Yeah, where there's like 2 ingredients, cotton and a string.
Right. I think that some things that can be chemical related are the scents that come with some of that, right? And again, I tell people to stay away from those just because they can be more irritating.
Also,
you don't need that, right?
It's
as
not
long
going
as
to mask anything.
Right. It doesn't really.
No.
And so that can be part of those chemicals.
Okay.
Sometimes being a little bit more absorbent. There are chemicals that can be that pull in the moisture from the bleeding.
The desiccant, isn't that what it's called?
Sure, yeah.
Look at the big
Look
word
at
on
you, chemist.
Hey, give me a nickel. You mentioned smell. So, it's something that comes along with a period. Is there anything that we can change in our diets to affect that?
Yeah, I mean, a lot of times I'll talk about probiotics because that can help change or keep the vaginal environment more stable. So that can do it. Sometimes more salty or fatty foods, the things that we kind of crave.
Yeah, you definitely crave that. Absolutely.
Yeah, can sometimes make that change. But honestly, I don't think that completely eliminating something from your diet is going to necessarily change the smell. The smell is there because you're releasing tissue from your body, right? Yeah. And it's that iron smell too, from the kind of like rusty type smell. Everyone smells a little differently, but smell of just the blood in general.
Yeah. All right. Cramps to some can feel worse with tampons. Have you ever encountered this with people?
Yeah, I mean, definitely there are a lot of reasons why you could have more like pelvic pain or pelvic cramping. And one of them can be there's a huge basket of muscles that are in. And I think you've spoke with Dr. Crane, one of our urogynecologist.
We have. We talked about pelvic floor. It was fascinating.
I mean, the pelvic floor is a really important part of the human body, particularly for women. It helps with walking, running, having sex, orgasm, exercise, having a baby, all those things. And those muscles, just like any other muscle in your body, can be super tight. And you can have more knots there or more pressure there. And so with a tampon, sometimes people notice more pain because those muscles are more tight. So it's like if you slept on your neck wrong and you push the knot, it's going to hurt, right? So if a tampon's there and it's painful, really it shouldn't be painful. Anytime you put something in the vagina, once it's there, you really shouldn't feel it. Okay. So if you're feeling it, could be the wrong size, it could be a muscle relation where you have just tight pelvic floor.
Yeah. Okay.
So definitely something to bring up if you do experience that.
Another question what we had is if you wear a tampon, is it going to prolong your period versus wearing a pad?
That's a good question too. I not necessarily. Your period's going to be kind of the time it's going to be. But what I think might actually be the opposite. So like wearing a tampon, it is in the vagina, so it's collecting that blood kind of at the source, right? It's coming out of the uterus, so it's collecting, absorbing it right away, versus it's sitting in the vagina and needing more time to come out in a pad. So I feel like sometimes it's the opposite, where you'll feel shorter, have less days of that tail end spotting using a tampon. Though then you have to be careful, because if you're not having a lot of bleeding, tampons can be more uncomfortable just removing. Right? Oh,
the worst.
Yeah.
The absolute worst is a dry tampon. It's the worst.
Right.
Okay. For any male listeners,
I
just know that.
We apologize, but this is life, right?
Hey, you're listening to this podcast, and you got this far in it, so you should be desensitized by this point. Lastly, I do want to put the spotlight on you and and the questions that your students have come to you, your state students.
Yeah.
So what's like one of the most colorful questions you've ever received?
Oh, colorful. Wow. That's a really good question.
I'm dying to know.
I mean, I think a lot of times, they don't necessarily feel, or I guess Generation Z does feel more comfortable talking about periods, but intercourse as well, and problems or satisfaction with intercourse. And so kind of talking about having sex with your period, or kind of the downsides, plus sides, things like that. So we talk about that. Sometimes talking about different options for, I mean, it's not really colorful, but talking about kind of what to use and how we use it, and kind of
like for masturbation kind of thing, or
for that, and
all of it. Okay. Do you have a lot of people coming in with the gender is changing? And so do you have questions involved with that at all?
Yeah, no, we do. I think that a lot of my partners, we feel definitely extremely comfortable talking to anybody about how they're feeling with gender dysphoria.
Okay.
And one of my partners specifically, that's kind of her niche. She's built that up for herself in our practice, and she's amazing for it.
Oh, that's good to know. That there's like an avenue for that.
There is, yeah.
Because I can only imagine someone who's going through a transition from female to male, and then getting mostly male on the outside, but still have a period. That's a whole thing.
Right. I mean, it's very disorienting for individuals. It's just not them, right? It feels wrong.
Yeah.
And so in those cases, when we have younger individuals who maybe aren't yet ready to make the surgical transition, they want to stop their period, and then we talk about ways to do that. And a lot of times with our younger generations, it would be more of kind of the birth control options, right? The hormonal options. And there are a lot of different ways to do it. But I mean, I have had a 12, 13-year-old boy who did not feel himself and wanted to come in and talk about stopping his period. And it was great. We had a really good conversation and found an option that worked for him. And
that's fabulous.
Right. Yeah.
Yeah. Well, that's a whole nother podcast.
Yeah, right,
I mean, there's so many questions. I was just like, it's just, there's a lot of questions there.
Yeah.
I think I have reached the end of my questions. You did great. Thanks for coming in today.
Yeah, thanks so much for having me.
I don't know about you guys, but that bit about the fallopian tube just randomly picking an ovary and crossing over itself to get to it legitimately blew my mind. I had no idea. You would think you could feel something like that. Moving on, if you have any questions that you want to ask me, go to the link in our show notes, and don't worry, you can do it anonymously if you want to. Sarah Has Questions is a production of Capital Broadcasting Company. My guest today was Dr. Anna Fleischman, a WakeMed OBGYN. To find out more about her or any of the other providers from the WakeMed team, go to wakemed.org. Thanks for listening.